Well, good evening and welcome all to Alameda County's Town Hall, educating the students of Alameda County in the time of COVID-19. We'd like to welcome you all to the Town Hall this evening. I am L.K. Monroe, Alameda County Superintendent of Schools, and tonight I'll be joined by several members of our team as well as our partners at Public Health. So I'd like to welcome and recognize Dr. Nicholas Moss, who has been our ever-present partner since the beginning of this pandemic, or since he joined the team. And I'd also like to welcome Lisa Erickson from Alameda County Public Health, who has been partnering with us, and we have been partnering with her. We'll talk about some of those ways in which our partnership has supported schools as we go through tonight's presentation and Q&A. On our team, we have Dr. Ingrid Linus Roberson, who is our Chief of Academic Services and our Associate Superintendent of Academic Services. And we are also joined by Michelle Smith McDonald, who is our Director of Communications and Public Affairs. Also tonight, you may be hearing from a couple of other members of ACOE's team, and I'll introduce them at that time. So this evening, we have a number of questions, as you all know, that have been submitted in advance. What you're seeing in front of you now is the link to the email where you can submit questions. We have had nearly 75 questions submitted to date, and we will be asking those questions this evening. So just so you know a little bit about how this is going to go, we received, as I said, nearly 75 questions, and what we did was group them by topic area and by subject area. So those questions that were similar in nature, we grouped them together. We hope we did a good job of capturing everybody's thoughts and concerns and questions to pose to Public Health and to myself and our team. So we have endeavored to make sure that each individual question was captured in one way or another. Please know that you have the ability to continue to submit questions until 7 p.m. tomorrow. So we're going to keep the line open for 24 more hours. The goal then will be to have an FAQ that we put together, and we will be disseminating in multiple languages sometime next week. So if a question comes up this evening, that either a question that's being answered spurred another question and you want to submit it, you have 24 hours to do that, and the answer to that question, if it's different from one of those that was posed tonight, you'll find in the FAQ. We really strive to find a format that would allow us to answer the most questions most efficiently. So what I'll be doing, and I will apologize in advance as I go forward, I will also be saying who submitted particular questions, and you'll need to forgive me for using first names. In the interest of time, we'll use your first name and what community you're representing. So also this webinar will be recorded and posted so that you can share it with your communities after tonight. So thank you and welcome all. We know that this is a critical conversation. We work with schools each and every day, everyone on this call does, and we do not take lightly the stressors the communities are feeling right now, the weighty decisions that need to be made. And at the same time, we are critically aware of how important it is to keep our children in school as much of the time as possible. Getting back to in-person learning was critically important to us. And so we are looking to support that effort in any way possible to keep our students in front of us. So with that, I am going to turn this over to Dr. Moss to go through our first slide, and we will be passing it back and forth as we ground ourselves in information with the slide presentation to start with.
Thanks, Superintendent Monroe. Good to be here.
Dr. Moss, I cannot hear you. I don't know if others can.
Oh, can
okay.
Anybody hear me?
Thank you.
You can. Okay. Good evening. Good to be here. First off, just a little bit of data about where we stand, right? So We have just seen a pretty substantial wave, summer wave, including a healthcare surge. But case rates, what you're seeing in this graph are case rates going back to actually January 1st of this year. The summer wave is that bump on the right. And this slide is from a week ago, but I will tell you that the case rates have declined even further. We're down to about 14 cases per 100,000 residents per day. We were at almost twice that at the peak of this summer wave in early August. Next slide, please. The pattern with hospitalizations tends to lag a little bit. We did not see, again, you're seeing hospitalizations by day in Alameda County back to January 1st on this slide. So that big lump on the left, that's the winter surge. You can see this summer we were about half that big. We had about half as many people in the hospital, and we were at that high level for a while. We're actually down a bit. We're down under 200. We had as many as 240 people in the hospital, but still a lot of people in the hospital. It'll take some time for those numbers to improve. Next slide, please. We also look at test positivity. Test positivity has come down quite a bit in the county in recent weeks, down under 3% overall. Now, a lot more testing has been done as schools have got back in session, as some workplace testing requirements have been happening, and I think as people have been concerned about the summer wave. Nevertheless, encouraging to see this decrease. And I will say that although we don't have the slides here, case rates in children are decreasing as similar to what you're seeing for the county overall. Test positivity in children mirrors this pattern. And we never really saw substantial hospitalizations in children, fortunately, here in Alameda County, even though there were news reports of that happening in other parts of the country. Next slide. And I think Superintendent Monroe, you were going to comment on this one.
Yes. So these are just some of the ways, as I referenced before, that we've been working together. ACOE, ACPHD, and our districts and schools. Something that you will see on our website is a lot of you are very familiar with the guidance on ACOE's website. That represents a close collaboration with ACPHD. So most of those resources you'll see have been linked from our Alameda County Department of Public Health, which references and closely aligns with California's Department of Public Health. So ACOE, even before the pandemic, we convened the leaders of each of our 18 school districts on a regular basis. Now we are meeting more frequently. We have now have calls not only with district leaders, but charter leaders, independent school leaders as well. So talking a little bit about what public health does, one of the things that both Dr. Moss and Lisa Erickson have been phenomenal about is whenever we have a convening or a call, making sure that they are present to answer questions in real time. From those calls, it's been essential and people have valued hearing directly from them. So our work directly with public health is what you see, the result of that is what you see in our guidance and in the conversations and FAQs that are put out on a regular basis. So there are also touch points with our districts and schools directly with public health. So public health has an email address with their Safe Schools initiative, and you can email them directly and they will answer particular questions. Lisa only seems like one person. She represents a team of very able practitioners who are really working to make sure that districts and schools have, and parents and community have the answers that they need. So with that, we just wanted to give you a sense of how this work has been really collaborative and how it wouldn't work any other way, but for us to be working in close partnership. Next slide, please. Back to you.
So Superintendent Monroe mentioned the guidance. And so we really, although we earlier on in the pandemic, there was a lot of local guidance. Really in 2021, we have pointed not just for schools, but for many things, not everything. We really point to the state's guidance, as the state has done a good job researching the evidence, putting together pretty practical guidance, and it continues to be our strategy. So the state schools guidance emphasizes layers of safety, and these are based on, although we didn't have lots of schools open last year in the United States, we did have some, and a lot was learned about what can be done to run a school safely, limit the amount of COVID transmission, even when there's high rates of community transmission. And it's really some of these practical layers of safety. So now something that we didn't have until pretty recently, one of the important layers is, of course, vaccination, but also having people stay home when they're sick, which is more difficult than it sounds for both staff and students and families, as we all know. Practical approaches to testing, ventilation, and of course, masks have been a really critical part. So we're going to take a little bit deeper dive into some of these topic areas. Next slide, please. So vaccination, Alameda County overall has actually done very well with vaccination. I think we're 5th out of California counties in terms of percentage fully vaccinated. And that is, the other high percentage counties are mostly in the Bay Area. So the Bay Area as a whole has done very well. And that puts us in pretty good company across the country and around the world. We have a lot of people vaccinated here, but still have work to do. So 12 to 17-year-olds, 80% have got at least one dose of vaccine. It's actually 90% for everybody over age 12 in the county. And then 66% of 12 to 17-year-olds are fully vaccinated. Next slide, please. So this shows fully vaccinated 12 to 17-year-olds by city across the bottom. And I don't know how well you can read it, but each city in the county is represented here, and some of the unincorporated areas as well. And you can see that there's a range. We have some communities with higher rates and some communities with lower rates. And we at the Public Health Department and Healthcare Services Agency continue to partner with ACOE and districts to try to get vaccine resources into the communities where the rates are lowest, where some of the same communities where we've seen high impacts of COVID, and that is ongoing. Next slide, please. Masking has really been shown time and again, both at the community level and within schools, to be a really key part of limiting the spread, keeping case rates down, limiting the impact on healthcare systems at the community level, and in schools, really limiting transmission, allowing us to get full classrooms back together in a way that we weren't able to do last year. So the state requires masking indoors for everyone in K through 12 settings, as well as childcare settings. Now, outdoors, CDC and the state have recommended masking when there's substantial to high transmission. That's most of the country right now, including most of the Bay Area, for people who are not fully vaccinated. So this, for people who are not fully vaccinated in crowded outdoor settings. So this is a situation that can pop up a lot with schools, and we think it's important for school communities to be aware of this. There certainly are exemptions for masking, as there have been all along, including age, medical exemptions, things having to do with hearing and communication. There are some didactic needs. These exemptions are all included in the state guidance. Next slide. Testing as well, in particular, making sure that sick or exposed people are tested, regardless of vaccine status. We really want to make sure that people who have COVID symptoms get tested, people who are exposed to a case get tested. The county, for the community more broadly, in particular, our most impacted communities, invest a lot in testing. The state has invested a lot in making sure testing resources are available to schools. Modified quarantine, which I think we're going to talk more about tonight, requires testing in order to be used by a district, and then unvaccinated teachers and school staff now are required by state order to test weekly. There are other situations in which testing is needed, and some districts are deploying testing of students who don't have symptoms as part of either voluntary testing programs. Most of these programs are no cost to students and staff. And again, a huge amount of state resources have been put into supporting testing for schools. Next slide, please. And so I believe Superintendent Monroe, or is this Lisa's slide?
This is my slide, I think, Nick. So I'm going to talk a little more about testing. Dr. Moss already mentioned that the state has been working really closely with all of our districts in Alameda County, those that have been partnering with the state around these different options. And so they've given options around PCR testing, PCR pooled testing, and rapid antigen testing. And school districts have been able to, throughout the summer and last spring, have been partnering with the state to figure out which option works best for their district. They really wanted to give them flexibility because it does take significant resources, staff resources, and also, you know, not every testing program is going to fit well with your particular community. So there is a lot of flexibility around these options. Next slide, please. We also wanted to go into some of this language that you're probably going to be hearing as parents throughout this whole COVID response. And these are two concepts that people sometimes get confused, and it's quarantine versus isolation. So we just wanted to clarify these. Quarantine is what happens when you've been exposed to someone with COVID-19. So it doesn't necessarily mean you have COVID or that you have symptoms, but that you've just been exposed. That's when you get home, you get sent home, or you're under quarantine, modified quarantine, or you're at home quarantine, but that's what quarantine means. Isolation is different. That's for someone who has been infected with COVID, or sometimes even just has symptoms of COVID and you're kind of waiting to see if it's COVID. That's isolation. And it's important to keep these two things separate. Sometimes I just think of isolation illness is how I remember that. But yeah, they're two separate concepts. Next slide, please. And this is ACOE does an amazing job of developing tools and resources for families as they're, you know, getting back into class. And this is one of these handouts. But what I wanted to just emphasize on this particular resource here is just the importance of keeping your kids home when they're sick. And this includes the list of COVID symptoms here. So pretty much any symptom, you really want to make sure that your children are home. Like, don't, you know, let them go to school if they have any of these symptoms. And there are ways to get back to class, you know, to come back when you have symptoms. The easiest way is to get a test. So we definitely strongly encourage getting those PCR tests when you have symptoms. And with a negative test, you can come back to class before, you know, so you don't have to wait for 10 days. You can also get a note from your medical provider. But this is just one example of a resource with lots of tips about getting back to class and how to prepare your students, your kids. Next slide, please. Another concept is this concept of close contact, which you might also hear. And this is how schools are doing their contact tracing. And we'll talk a little bit about contact tracing in a minute. But this is how we define close contact. So it's anyone who's been exposed to a positive case, a person with COVID, for 15 minutes or longer over a 24-hour period within 6 feet. So it could be, you know, you've really had close contact, like within 6 feet, at maybe 5 minutes throughout the day, that would be considered close contact. Another way to define close contact is if you've had unprotected direct contact. Someone maybe isn't wearing a mask and a child like sneezes or coughs really close to that person, that might also be considered close contact. Next slide, please. And another concept that I'm sure many of you have already heard about, and it has been a little bit confusing. It's a new option that the state has offered schools called modified quarantine. And this quarantine protocol allows for students to actually quarantine but return to the classroom. But there are some requirements that schools need to adhere to in order to do a modified quarantine. The students must be asymptomatic. That means they're not, they don't have symptoms. And this is for unvaccinated students. So vaccinated students don't actually have to quarantine. And this allows them to come back for in-person instruction, but they need that exposure must have occurred at the school setting. So the exposure can't happen in community settings or in a household. It has to happen in the school setting. And it doesn't apply to extracurricular participation like sports, but however, it can be applied to after-school care. And it does not apply to staff. And it requires that students be tested twice weekly. So, and if they get their last test on the day 6 or later, they can actually exit this modified quarantine on day 8. So they could be released from the quarantine on day 8. And so just want to summarize, modified quarantine, it allows students to come back to class. But it has to be mask on mask exposure, and it has to happen at the school setting, and it only applies to students, not staff. Thanks. Next slide, please. There's also another quarantine option called a shortened quarantine. This is a little different than the modified quarantine. It can happen with exposures that occur outside of school, and it can be for unmasked or masked. But again, it's for unvaccinated close contacts who remain without symptoms. And this allows them to come back to school on day 8 if they have their test taken on or after day 6 and the result is negative. Then they could come back on day 8 as opposed to staying out for a full 10-day quarantine. So this is another option that some districts are choosing to use. Next slide, please. And contact tracing. Which I'm sure you've also heard about this concept as well. This is what schools are doing to help identify individuals that have contracted the disease, or to help identify those who have come in contact with someone with COVID-19. So schools have been doing lots of contact tracing, and we've been partnering with them very closely since the beginning of the pandemic around identifying close contacts that are on campus. It's very difficult for the public health department to know, all of the individuals in these school settings and who had close contacts. So we really rely on schools to partner with us and share this information with us. And it also, the contact tracing is what allows us to determine who needs to quarantine to keep all the kids on campus safe. And we provide quite a bit of training around contact tracing and really all of these concepts that we're presenting today for our districts and schools. Next slide, please. And this, I think, is you, Nick.
Yeah, so thanks, Lisa. So, one question that has come up a lot is lunch. And masks are required by the state in school settings, but of course you have to take your mask off to eat. Everybody probably knows by now that indoor dining is a place where we get concerned about COVID spreading. So I think there's a few, first of all, the big picture is we have learned that we really cannot eliminate the risk of COVID completely. It's going to keep circulating in our communities, even parts of the world that for a while had kept it at zero. It's just not going away. So with schools, it's really about balancing that risk against the importance of getting kids back into classroom and using these layered approaches to try to limit the risk as much as we can. And so these are some of the guidance that we provide to schools and that the state provides in terms of options for lunch. So first of all, maximize opportunities for outdoor lunch. I know, we hope it'll get rainy at some point. A few raindrops fell today. We have smoke issues around here, but and not every school is created equally. But for schools that can do it, getting kids outdoors to eat lunch as much as possible is a great option. Outdoors is always going to be a little safer. You get that fresh air. In indoor spaces, also maximizing ventilation. That's an important part of COVID strategy overall. And again, not every school is created equally, but maximizing the ventilation in the lunch space, even if it's just keeping the windows and doors open, helps as well. Look for opportunities to spread out, use classrooms. You don't have to have everybody in the same old cafeteria. Seating assignments can be helpful, especially for younger grades. If in the situation arises that somebody does have COVID, whether they got it in school or not, if you know who they sat next to at lunch, that can be very helpful. Of course, get the mask back on when not eating. And one way to do that is to limit, even if lunch is 45 minutes, really limit the time that students spend eating to as short as possible. There's going to be practical limits to how short you can make that. But getting those masks back on and just making sure at the school level procedures are in place to make this stuff go smoothly. That's, with COVID, as important as anything. Next slide, please. Back to you, Lisa.
Yeah, I think back to me. So I'm just going to talk a little bit more about extracurriculars, which include indoor sports and performing arts. The state recently updated their guidance, I believe it was last week, to have a little more guidance around sports and extracurriculars. So masks are required for all people while playing all indoor sports and performing arts, unless they're a choking hazard. And they actually refer to the AAP, the American Academy of Pediatrics, to determine which sports are, or activities are considered choking hazards. And some examples of those would be wrestling, gymnastics, cheer, and then wind instruments is an example of where you can't always wear a mask when you're playing wind instruments. So in order to allow these activities to continue, the state has provided this guidance. There's 3 mitigation options that schools have. They can move this activity outdoors. They can modify face coverings. Like if you're playing a wind instrument, there's certain kinds of face coverings you can wear that allows for the wind instrument for them to still play it. And they also have coverings for the instruments. Or they can perform at least twice weekly, or at least weekly screening testing. And they have options here for the different kinds of tests. So they have those 3 options for those particular sports that are played indoors where masks aren't able to be worn. But for most other sports, you can wear a mask while you're inside. And then the outdoor sports, the guidance, applies the regular school guidance. So this is kind of, and then we also have some local sports guidance that's on our website that we won't be going into too much detail today, but this is an overview of what the state has just put out. Thank you. Next slide.
So I'll take this one. Independent study has definitely been a topic we've talked a lot about with district schools, parents, and community. So Senate Bill 130, the California Assembly passed Senate Bill 130, which designated independent study as the lone alternative to in-person learning. So lone meaning that we've gotten a lot of questions about whether we can go back to some sort of hybrid or distance. This is the only option that has been provided under this law for districts and public schools to be able to engage in. So short-term independent study is applicable when students are quarantining over a particular period of time. and long-term independent study for students returning is not for students returning to in-person instruction. So long-term independent study is something that some districts and districts provide, families may have chosen for their students. I'm going to stop here. This is only a few high-level elements of independent study. We do have a couple of questions about it where we'll dig a little more deeply when we get into the Q&A. Next slide, please.
Okay, this is where I'm going to come in, Michelle Smith-McDonald from Communications Department. Wanted to just chat with you about COVID liaisons. So all of your schools, TK-12 districts, as well as private and charter schools, have a designated COVID liaison, either at their district or at their school site. If you are a district with multiple schools, you also have school site level liaisons. They are the folks that are in charge of responding to COVID-19 concerns for your district or your school, providing information and guidance to the community, and they are the primary liaison with public health. We have been working with public health, ACPHD, our partners on this call tonight, to collaborate on regular trainings for this group of folks so that they are up to date on the latest changes and shifts and all of the information they need to provide that service to your schools. Next slide, please. And then lastly, what I wanted to do is share with you that a lot of the information that you've seen on these slides, which we will be posting on our website, but is also available in our guidance document. So acoe.org guidance at the bottom, you'll see on the screen, is the place where our guidance document lives, where there are links to all of the various guidance that our schools are following. We have been maintaining this guidance document now in 2 different forms since last spring. And it's used in our Zoom meetings with school leaders and previous town hall meetings, but this is the Bible, so to speak, for schools and the guidance that they use around health protocols. So I wanted to refer you there. And then I'm going to pitch it back to Superintendent Monroe as we move toward our Q&A.
Thank you so much. So thank you, Dr. Moss and Ms. Erickson, also for the information that we ran through with the slides. So we're going to try to be very efficient with our questions. We have a number of questions that we want to make sure we get through in this time. And again, for those of you who may have joined just after the introduction, these were questions that were submitted in advance. The link, I believe, folks have for submitting questions. We'll be taking them for 24 more hours. So if you learned something that is raising a question for you, you have until 7 o'clock tomorrow night to submit that question. It will become part of an FAQ that we will put out in multiple languages next week. So this webinar, these slides, as well as the FAQ will all be posted for people to watch after this particular presentation. So what I will do is I'm going to talk about, I will name the subject area that the questions are clustered into, and then just mention by first name. Again, I will apologize for referring to everyone by their first name, but in the interest of time, we wanted to make sure that we are acknowledging the questioners and able to get through the questions. So the first questions have to deal with vaccine mandates. And this set of questions came from Ahmed, Swati, Misty, Chris, and Marianne. These are all Pleasanton community members. So it says we've gotten several questions around vaccine mandates for students, particularly with news today that LA Unified is mandating vaccine for students 12 and over. Dr. Moss, can you speak to that from a public health perspective?
Sure. Well, first and foremost, I mean, we, from a public health standpoint, we want everybody who's eligible to get vaccinated to get vaccinated. It is really the tool that is saving lives, preventing people from getting severe COVID still. We are looking forward to sometime in the fall having an approved authorized vaccine for the younger children. We don't have that yet, but I think that's going to be really important as we try to push beyond the worst of this pandemic. In terms of vaccine mandates, so my understanding is districts can do this, and we know that some are exploring them, and did see the news about LA. There are other mandates outside of school settings. There's a state requirement for teachers to get vaccinated. There's a big new federal announcement today. So we are expecting even though we already have high vaccine levels in our communities, that we're going to see further increases. At this time, I'm not aware of any local health jurisdictions that are requiring vaccines for children in any setting. Typically for schools, it's been the purview of the state. We're going to look to see if that happens with COVID as we get more vaccine, as the vaccine becomes approved for the 12 to 15-year-olds, it's still emergency authorized for them. And then as we get an option for the younger kids. So that's where we are. Nothing planned from the public health department, but following closely what's happening at the districts.
Thank you so much. So the next set of questions has to do with modified quarantine and this test to stay strategy. So they're very closely linked. We've talked a little bit about modified quarantine, but the question from Laura, Linda, and Allie from Piedmont reads, our next area of questions around quarantine, isolated protocols, particularly about a protocol called test and stay. So Dr. Moss, can you share what you know about that protocol and how it differs from other protocols or how it's similar?
Sure. Well, I think I know a little bit. It's been published. Test to stay, like what we have in California, modified quarantine. Those are both strategies to essentially keep kids at school, to minimize the disruption. So we've got schools back open, we've got kids going to class again, but COVID's still around. How do we minimize the disruption? And so, and what people have done is they've shown different ways to try to minimize the disruption. And that means keeping kids who are exposed, close contacts to a case in school, keeping them in class as long as they're not sick. And there's different names and that you can use, different versions, but really what it is about is under certain conditions, allowing kids to stay in school after exposure. And I think the evidence in test to stay and the evidence for modified quarantine that we've seen from Georgia, in fact, a new study in university students came out from St. Louis today, that these approaches can be done safely. So I think modified quarantine is basically the same idea, and that's something that schools can use here. All of these approaches do require testing, so it's it's an organizational lift for the schools, but I think again, trying to minimize the disruption to learning by keeping kids who can stay in school using testing is already available here in California.
Great, thank you so much for that. Our next question, we have one question about outdoor masking, which was submitted by Jillian in Pleasanton. So why are you recommending that students wear masks outside, Dr. Moss?
So thank you for the question. So what we've done is we've shared the CDC and the state's recommendations regarding outdoor masking for people in crowded settings when case rates are high. And again, case rates are high really everywhere in the country and in California right now. And even though we are sort of on the tail end of this, it appears we're on the tail end of this wave, and let's hope that it doesn't start to creep up again. We are still at very high levels of COVID. So what we've done is we've shared the CDC's recommendation and the state's recommendation. Masks are recommended in crowded outdoor settings when unvaccinated people are there, and that is actually a lot of school settings. But it is really just the state and CDC's guidance for crowded outdoor settings that we've shared.
Thank you for that. So the next questions are around lengths of quarantine. So 10-day quarantines are, I'm sorry, this is also from Jennifer in New Haven. 10-day quarantines are taking students out of class. 1, is it necessary to quarantine for 10 days? And 2, why are the quarantine lengths varying by school and district? Some seem to have longer periods, others seem to have shorter.
Yeah, I think this is definitely one of the more confusing areas, and for people who are just, we've been living and breathing it forever, but I know for a lot of families, they're just having to experience all this now with a return to school. Um, we know that people can get COVID and not have symptoms and be infectious, and that's why people who are close contacts to a confirmed case have been required to quarantine here and pretty much everywhere, I think, around the world since early on in the pandemic. Now that over time we've learned it started with 2 weeks. 2 weeks is probably still the absolute safest sort of practical approach to quarantine. But we've learned that the risk is pretty low, even if you quarantine for 10 days. And if you quarantine for 7 days with a test on day 5 or later, that is also relatively safe. It's unlikely that you're going to come back on day 8 and develop COVID and infect people if you have that test. Those aren't perfect, but those are the quarantine options that are available. And those options are available to anybody in Alameda County, kids, school staff, family members who are exposed to a confirmed case. Those are the regular quarantine rules. Now, modified quarantine is a tool only for in the classroom in order to allow kids to basically quarantine in place in their classroom so that they don't have to have their education disrupted under certain conditions. So again, it's a 10-day quarantine or 7-day quarantine with testing, and those are at home. But modified quarantine, you can stay in school. You do have to get tested twice during that modified quarantine period. Can't have symptoms, things like that. There are some other conditions.
Thank you for that. We have several, as you will not be surprised to hear based on what you've heard to this point, several questions on testing and the frequency of testing and what that looks like in schools. So from Ken in San Lorenzo, from Shelley in New Haven, and Christina in New Haven. And then we have Sama, Frank, Gerald, and Amanda from Pleasanton have all submitted questions about testing. So here are generally 2 questions that cover the topics that they were interested in. So why doesn't the county require weekly testing for both students and staff? Can schools provide free testing weekly? So let me address this first, just from an administrative perspective of schools, and then I'll invite Dr. Moss to add anything to it that he thinks would be useful. So we pre 21-22 school year last spring were offered testing for districts and for the county office. We got a contract so that folks could really do testing and bring at least their administrative staff back and some students back to school. That was a fairly manageable proposition to do, working with private testing companies. Moving forward, as schools opened, you now have your full complement of staff returning, you have students returning, and add to that the Delta variant. And there is a huge demand, a huge load on districts and the state to stand up testing. So the state has provided tremendous resources for testing. However, those resources are scarce at the moment because so many districts have demanded them. So there is a shortage of antigen tests right now at the district, which is what most districts have been using for student testing. And we as ACOE are keeping a close eye on that, as is every other county in the state. We're all in the same position, waiting for more of those tests. The other barrier, as you've heard earlier in the conversation, is that it's a huge lift to stand up testing weekly, let alone 2 or 3 times a week for any portion of a school community. Most schools are working very hard to solve this problem. We are looking at helping schools with this by forging relationships also with community-based organizations and others who might be able to help. That is happening in real time, but there is definitely a lag. And schools are looking to keep their students safe, get their students back to school, keep them safe first and foremost, and then really trying to set up the best testing protocol they possibly can in the midst of everything else. So Dr. Moss, I don't know if you have anything to add on that first one.
Well, just the most important thing is that symptomatic and exposed people get tested. This is the recommendation that you're going to really see from public health departments and in school plans around the region, around the country. After that, there really isn't a magic formula. There can be some upside to weekly testing. It can be a heavy lift. And I think one concern is that, the benefits aren't so great that if a testing program results in schools not being able to get open because it's too operationally challenging, that's probably not in the student's best interest. And we don't think makes sense from a public health standpoint. So for that reason, and because there really isn't one strategy that's been shown that is going to work and sort of leaves the rest behind, there's flexibility, and districts can use the strategy that's going to work best for their community and their students. And I think you'll see, if you look around the region, there's a pretty wide approach. Now, if we learn this fall, we're still learning about COVID all the time. If we learn this fall or sometime in the future that one strategy makes more sense than another, then I think you will see the guidelines change to reflect that. But for now, there isn't one strategy that we would recommend over the others.
Thank you so much for that. There was another part to this question that I already answered, which was logistical and operational as to what the barriers are to the frequency of testing. And the second half of the first part of the question asked about free testing, and the resources by and large are free for testing in schools and in districts. Those are being supplemented by the state, and any other costs associated with them. Districts are using their dollars that have come from the state or the federal government to cover. All right, the next set of questions, I see Dr. Linus Roberson joining us, are about distance learning and the options for distance learning. So this is where we can dig in a little bit more to independent study and the fact that distance learning is not an option by law, but what districts are actually doing. So we have questions from Priya, Haofeng, Mamta, all from Pleasanton, Sheila from New Haven, and Jennifer from San Lorenzo. So Dr. Linus Roberson, I'm going to pose the questions to you, and I think we have one for you that's public health facing at the end, Dr. Moss. So can students switch to distance learning during a quarantine or periods of isolation, Dr. Linus Roberson?
Thank you for that question. Yes, so students are able to switch to remote learning. That is done through independent studies. So as County Superintendent L.K. Monroe stated before, the legislature provided two options. Essentially, you are either doing full-time in-person learning at the school, or you are having the option of remote learning through independent study.
I'm on mute. It was bound to happen at least one time. The second question, why can't we provide similar remote options to the ones we had last year, particularly for younger students who cannot get vaccinated?
Thank you for that. So as I was saying, the legislature did land on two options, and the why is really hearing from education leaders, community leaders, parents, and especially our communities who are the most historically underserved, that really these were the two options that were best as compared to the hybrid that I know that we enacted really at the start of the pandemic, but a lot of lessons were learned over that school year and landing on those two options.
Thank you for that. So when entire classes get quarantined, can they go to class virtually right away?
So that is dependent on each district, but as I understand it, this is what districts are doing. And what they do, again, is activate the independent study option. So that does require, even in a short term, as quarantine is 10 days or less, that in the short term, they do have to get signed agreements from parents and guardians. However, they are able to do that immediately. The cleanup language that has just gone through this week allows for that starting day one of quarantine and isolation.
Thank you. So number 4, why were families offered independent study if there was going to be a wait list? Weren't schools able to anticipate how many families would want the virtual option? I'm going to answer that one. Because these are the questions that we're having with our educational leaders, if not weekly, then daily. So yes, there isn't a district or school, public school that I know of that did not ask their community going into this school year who would be interested in independent study. For most, this survey or the questions happen prior to the Delta variant and the resurgence of cases. And there have been many families in the wake of that that have said, oh, I'd actually like independent study. And in some of our districts, that's been as many as 5-fold requests for independent study, which is very difficult for a district because there have to be teachers assigned to that program. And most districts who are experiencing exponential increases are in real time looking to staff up right now where they can to accommodate that need for families. And as Dr. Linus Roberson said, the assembly in particular, but the legislature was very committed, and there were many conversations on the way to this independent study legislation, but very committed to ensuring that there were actually very few options for families not to have their kids return to school, because the data have shown, and we know by experience, that school is the best place for children, though there were some kids who flourished in independent study, which gives districts an opportunity to look at their learning programs and figure out how they might take those learnings and augment their instructional programs. But by and large, we want to make sure students are in school, and we want to make sure students are kept safe in the process. So that answers that question. So Dr. Moss, what is the criteria for which public health, by which I think public health would recommend closing schools?
Well, I think, first of all, I look how far we've come to be at a place where we have schools open, and we have to have this discussion about whether we need to close them again. For much of last year, we were really trying to find a way to keep our communities safe, to find a pathway back to schools opening safely. And just to be at this place where we even have to have that question, I think, is a reminder that that we finally have our kids back in-person learning, something I know that they've missed and that had a lot of consequences. And so the state did not put specific thresholds for closure in their guidance, and we haven't added them locally either. I think the reason is really we consider it our responsibility, and I think baked into the state guidance is the idea that we want to keep kids in classrooms as much as possible. That's why there are things like a mask requirement and modified quarantine option, and really things that are designed to avoid having kids have to go out and go home. And so in most situations, I think it's important for us to do the work and support schools to do the work to find out, is there somebody who needs to go home? Is there somebody who needs to go home? Make sure that person goes home. Make sure only the kids who really need to go home, and that the other ones can stay and continue their in-class learning. There are going to be situations where it's difficult to do that, and on a case-by-case basis, our outbreak investigators at the public health department we'll work with schools to say, look, this, in this classroom, everybody needs to be quarantined. Hopefully we won't have any schools where that's the only strategy available to us. So on a case-by-case basis, we might do that. But first and foremost, our goal, keep kids in school, really limit the quarantine, the home quarantine, only to those who really need to go home.
Thank you for that, Dr. Moss, and thank you, Dr. Linus Roberson, for addressing the independent study questions. So we have 5 minutes and several more questions left. So there are a few that I'm going to make sure that we get through rapidly. So for example, we have some close contact and exposure questions from Kelly in Pleasanton, Bernadette in Pleasanton as well, and then another one from Stacy in New Haven. The question regarding close contacts and our tracking of close contacts, I want you to know that we have COVID liaison training. There are designees in each district who are trained to trace cases, track cases, and work with public health at a school level. So we can give you more information about that in the FAQ. Another is, there was a question about personal protective equipment. And what you should know is that most schools have good access to personal protective equipment, that while Cal OES, Office of Emergency Services, is no longer distributing that, there are a couple of ways schools have funding now to purchase those, and the state has negotiated contracts. A couple of other questions around safety mitigation strategies. And by the way, that particular question about personal protective equipment was from Ethel in Oakland. Safety and mitigation strategies from Monta in Pleasanton, Megan in Oakland, Swati in Pleasanton, and Stacy in Piedmont. What additional measures are being added to keep our kids safe while in school, particularly during concerns, during lunchtime in particular? Dr. Moss, unless you have something to add to that, I'm going to say that was something that was, I think, well covered in the slides. Is there anything else you would add?
I would just say that so far, case rates in kids are falling, fewer in the hospital. And so, I think right now we want to certainly see how it rolls out with schools. And I know the state is going to look at whether they need to make changes one way or the other, but we are not seeing a signal to suggest things are going the wrong direction.
Thank you very much. And I'm going to go back up to the close contact and just let you know that I am aware that there's a question about contact letters going out, which we will address in the FAQ, and enforcing the return of students to school after an exposure. Districts have their policies. We also convene the board members of various, the 18 school districts in Alameda County on these calls and in other ways. And district boards are developing those policies or have developed those policies at the district level. So I'm going to move on to a question about dashboards and transparency. Will Alameda County consider an aggregated school dashboard to increase transparency for families? So I'm going to have Lisa, you can initially respond to that, and then I'll respond with what ACOE is going to do.
Great. So we are going to be partnering with districts to make sure that as they develop their own dashboards, that those dashboards have similar data indicators, so that we're able to compare across districts as well as use that data in an aggregate way across districts. One of the reasons why we want to work with districts around that is that sometimes they get the data quicker than us. So that data is, they find out about cases sooner than we do often. And so it's really important that districts have their own dashboards. And so we're going to be working with them over the next very, very soon to kind of make that data all kind of aligned, hopefully across the county.
Thank you for that, Lisa. Actually, you covered that very well. I think what you can anticipate, we're working on that now, as you can hear with public health. and look forward to having a public facing through ACOE with public health facing dashboard so that people can get a sense of what things look like in schools for the county. Right now, you can go to the various districts who have their own dashboards that report on slightly different things to get a picture of things. Okay, I'm looking back through the questions. I think there is one more that I didn't get to cover under safety and mitigation strategies. What metrics will you use to remove mitigation measures, masking, quarantines? What evidence are you relying on? I think this is a little bit goes to that same question about when will you know to close schools? This is the converse of that question. When will you know that we can ease restrictions and mandates?
Should I speak to that briefly?
Yes, please.
Yeah,
Just very quickly.
first of all, I think that, I can't speak for the state in terms of what metrics they're going to set for making changes to their guidance. Although I do think it will be driven by whether we're seeing transmission in classrooms, and if that's because, in the setting of people actually following the guidance or not. I know that the state had intended to look at the guidance after the start of the school year and really see if there were things that they could remove or go the other direction if necessary. Locally, more broadly, we are certainly with the pandemic looking at how much severe disease we have. Are people ending up in the hospital? Which we had a lot of hospitalizations with the summer surge. We have a lot of unvaccinated people in our communities still. And I think that's the big thing for us in terms of moving beyond the pandemic. When there's COVID in our communities, but people aren't getting severely ill, hopefully not getting disabling long COVID, that's really the end goal. But over time, we have been slowly peeling things back. And I think we're actually at a place where we're regulating very much less than we were in last year.
Thank you so much, Dr. Moss. And I really just want to say thank you to Dr. Moss, Lisa Aronson, the whole Alameda County Public Health team. Really want to thank Team ACOE. The word tirelessly is overused, but it is appropriate in this case. An incredible amount of commitment to making sure you have the most up-to-date and accurate information. Want to remind you this slideshow and this webinar will be posted. You can continue to post your questions for the next 24 hours to acoe.org/questions. We will have FAQs in multiple languages next week available to you. I think, what have I forgotten, Michelle Smith McDonald? Did we get it all?
We got it all. Thank you to our Spanish language interpreters who helped to make this a more broad-based presentation this evening. We want to say thank you to them. And yeah.
Well, we really appreciate you all. As I began with, this is no small thing. This is nothing any of us knew how to plan for. And we're working together to do the very best we can. We are really committed to each and every student in this county and well beyond. And we really want to work in partnership with you to make sure that every student is having a safe and high quality educational experience, even in the midst of this global pandemic. So thank you all and have a good evening.